We are breaking this healthcare system. The mouth is not part of the body. That everyone tells them you're doing fine, but then their health is in decline. When I started practicing dentistry in the US about 12 years ago, I really realized that by design, there is a huge disconnect between dentistry and medicine. And these two entirely connected parts of the healthcare system are intentionally made to not talk to each other. And when I say intentionally, I refer to the entire process of the education, meaning that by the day that someone is called a dental student, there's this predetermination that is taking them to a direction that is different from someone who is, let's say, in an ophthalmology program or in any other parts of medicine that goes through the MD program when they're getting their medical education. By just disconnecting these two, inherently we're breaking this healthcare system that, okay, the mouth is not part of the body. Now, when the student goes through that, there's different levels of education that they're receiving in terms of the medical knowledge, depending on what they're interested in. But the program is not designed to make them that type of a doctor that sees themselves as a physician specialized in the mouth. The way that I always saw that coming from, a different background where I did my dental school back in Iran, which was a 7-year program directly from high school, all the way coming to the doctorate of dentistry. It was 2 years of basic science that was the same program as medical school, and then we were doing a board exam, and then we were doing 2 years of preclinical, which was on models and lab work, and then 2 years of clinical on patients, and then 1 year of research at the end. So it was a 7-year comprehensive program to really build you to become a specialist in the oral environment. We had internal medicine, we had forensic medicine, we had ENT, the same pathology, the same embryology, histology, all of that a medical student was having. Then coming to the US, really understanding that the education of dentistry is really limited to whatever is related to the tooth and oral cavity, plus some pharmacology and some other basic level of anatomy, was a bit shock for me, considering people get undergraduate education here that they can learn chemistry, biology, psychology, whatever they do, but then that really is not the same as the basis that they need and they receive when they go to med school. So now we have these doctors that the society don't see them as the real doctors. They don't get the education that a medical doctor is getting, and then they're coming with super highly skilled and specialized knowledge of the oral cavity, but with a disconnect of how this connects to the rest of the body. Now, on the flip side, there are all these medical students that are getting all the medical knowledge for all of the body except the mouth, because that is the part that is intentionally omitted from their curriculum. They might know the name of the teeth and they might know the basic anatomy of the oral cavity and the nerves and those things, but it does not go anything above that. Now, these people come to the real world with an actual patient who their mouth is connected to the rest of their body, and now they're dealing with these two sets of people with two sets of completely different understanding of healthcare, trying to collaborate on a unique patient that has a need that pertains to both of them. What I mean by that is that, let's say a patient is coming that has diabetes. A patient who is having diabetes and experiencing periodontal disease because of diabetes goes to a dentist. They might get a deep cleaning, they might get a referral to a periodontist, which is a specialist for doing periodontal surgeries, which is gum surgeries, and they go there, they get these beautiful surgeries, and they can get their pocket reduction, they can go get guided tissue regeneration, guided bone regeneration, all those beautiful stuff done to the 10th of a millimeter accuracy without really handling their diabetes. And then they get to these medical doctors that they don't understand that patients who are having diabetes, their periodontal disease is contributing a major part into the severity of their diabetes. So their They're putting the patients on metformin, on GLP-1s, insulin, all these medications, but they're not really medically treating their periodontal disease as a treatment for diabetes. So now the patient lives in these two worlds. They're getting half of the treatment from this person, the other half of the treatment from this other person, without these two systems talking to each other and without a core diagnosis of really the doctors knowing that theoretically everyone, by the way, knows that these are related. I'm talking about the actual practice of medicine. Like, patient goes to a periodontist, the periodontist does not tell them like, hey, I'm going to work on your diabetes to get you healthier, or the physician is not telling the patient to go get your periodontal disease fixed to fix your diabetes. And a major part of this in the current ecosystem is that the medical insurance companies are completely separated. So we have this medical insurance that's paying for the insulin but is not paying for treating the periodontal disease, and then we have this dental insurance, which is not a real insurance. It's just a little coupon that they give $2,000 a year to the patients to go get some dental treatment, and that one doesn't care about the diabetes of the patient. So now when the patients are navigating between these two systems, they just have to do it solely based on the level of education and the depth of the knowledge of the individual doctors that they find. So now if they're lucky, they might find a good dentist who knows their relation, the correlation, and happens to work with a strong physician as their referral system, that they work closer to each other and they can treat that level of patients, and vice versa. They might find a great physician that is working with a periodontist or a dentist who can create that connection, but that's pure luck for the patients. That is not built into the healthcare system. It is not built to the insurance model. And this is one of many examples that where this disconnect inherently is built into the system from the moment that these doctors are trained and the patients are connected to the healthcare system, all the way through the patient's journey and the continuation of care. That's where the problem is. If we want to come up with a solution, there has to be a fundamental solution. The entire education of dental school, the curriculum needs to fully transform into blending in with the medical school with a specialist type approach to dentistry. So you are training doctors who are specialists in oral cavity, the same way that you have cardiologists and neurologists and all these people. Same thing should go with the mouth, so you get the same level of caliber of doctors coming out. Also, on the provider side, you want to make sure that into the system, it's built in that the mouth is treated as part of the body. For us, is shocking that the infection that exists inside of the bone of the jaw and inside of the gum tissue that is directly connected to the bloodstream and is going to the systemic circulation and is going all around the body is being constantly neglected by the same doctors that are responsible to treat infection in the patients. They go and they get the blood work and they see that, okay, everything is within the normal range or whatever, but then the normal range is such a skewed range because when you have a patient population that 65% has periodontal disease, that can completely skew the normal range that you accept as basically normal, while you're getting these studies and using those studies to create your compensation structure in your insurances. So now we have all these patients that go to these medical providers that everyone tells them you're doing fine, but then their health is in decline. And then the question is, okay, well, if I'm fine, if I'm coming to see you every year, if I'm getting all these lab work that you're telling me that I'm doing fine, why is my health in decline? My inflammation is not managed, my weight is not managed, my cardiovascular health is not managed, and my oral health is not really managed either. Most of the patients that I have done periodontal surgeries on, we have taken out their teeth and given them implants, they have been going to their dentist their entire life every 6 months. Then the question is, why are they losing their teeth? Why are they still wearing down their teeth? A big chunk of it could be argued as normal wear and tear, but not to the level that we're experiencing. When I get patients that I show them in the mirror that half of their mouth has accelerated in aging 3 times more than than the other half. The question is, what is happening to that side that is not happening to the other side? And that's most of the times a medical answer. It's not that, oh, your bite is heavier on this side or the other side. It's mainly, why are you in such a state that you're grinding and clenching that is affecting the vulnerable side to the point that it is? Because you can have another patient with a bite which is as wrong as the first one without any of those problems, because that other one doesn't have that underlying medical problem that is being missed. So it all comes down to this concept of supervised neglect and standard of care, which means people are going to highly reputable medical institutions, highly reputable universities that are known worldwide, and not getting proper diagnosis, and then coming back and either losing their trust and saying, yeah, I went there, they just told me everything is good, but deep inside they know that there's something that they need to search for, so they have to take it upon themselves and go do their own research, become their own subspecialist in their own problem, then fight the system to find the team of the people who will actually understand and acknowledge what's going on with them and are willing to step in and treat them. There's so many of these patients that are going into the system and literally being told that you're not sick enough for us to do anything for you. Once you're sick enough that we actually take you seriously, you should come back. And then they are kicked back to us, coming with all those questions and frustrations. You sent me to this specialist, they're sending me back saying that everything is fine, but I know that everything is not fine. And again, tying it back to the insurances, when you have this built-in filter in your mind as a healthcare provider that, okay, well, up to this point of sickness, the insurance is not going to pay for the treatment of the patient. There's not really anything we can do for the patient anyway. So we're just going to do a bunch of palliative care, knowing that they're going to get sick enough to the point that the insurance would pay for it at that point, probably in the next couple of years. So we're just going to wait for 2 years for them to get to that point, and then when the insurance pays for it, we're going to do something. And that is a core issue that we're dealing with across the board. And ironically, that's even worse for the insurance companies, because when insurance companies have to get the patient that is at that level of sickness, that's when they have to pay for all those expensive surgeries and all those interventions, which could have been prevented 5 years earlier when the patient was actively coming to seek for help and being told that everything is good, you should wait. So insurance would have saved so much money on a collective level, the society would have been so much healthier, and the providers didn't have to deal with all these sick people all the time. And that's what I mean by systematic failure in the healthcare model. Now, where dentistry ties into this is that most of the times in these type of situations where there is an autoimmune problem or inflammatory problem or diabetes, cardiovascular, these type of things, or anything related to sleep apnea, the first symptoms or kind of clues to what is going to be happening to this patient shows itself in the oral cavity. Minor gingivitis, minor dry mouth, some sort of out of ordinary wear and tear on the teeth or erosion, or parafunctional habits such as grinding and clenching, and these things are very easily detectable by the dentist. And if they had these tools, that they would have been treated as the primary care level of triaging these type of people, all of that would have been so much faster, instead of doing this situation that the dentists catch this, send it to the doctors, and the doctors telling them to stay in their own lane and not interfere with the medical issues. So now we have 2-3 different problems. We have so many doctors that don't have the training, so everything gets missed. Patients hear that everything is good, they believe their doctors, the underlying diagnosis never happens, patients are in this decline. The second part are the people who are proactive, they catch it, they send it, it comes back that everything is fine, or we know better than you, don't get involved, or the other party also sees it, but then the insurance is not ready to pay for it. So like, okay, you know what? Let's monitor, and then in a couple of years, we're going to do something. Whenever I hear let's monitor, the question is, what are you monitoring? This is not going to just self-resolve. It's going to get worse. So you are basically monitoring something as it's getting worse, and the patient has to pay for it. And again, ironically, insurance has to pay for it too. Now, one of the ethical solutions that the dentists come up with with is that they completely remove themselves from the insurance system because they have the luxury to do that. If you're not an employee of a hospital or an employee of a healthcare system, you don't need to go by those rules. That's why dentists create this basically almost like a retail type model that they provide the care directly to the patients as if it's a small business and they just run it like a little dental office, as we call it. But the value of that is that the dentist has a full autonomy of how much they want to get involved in this game. I'm a dentist. I don't want to go by the rules that are imposed by this faulty system on me. I'm going to be out of network with all these insurances and I'm going to dictate how the operation is going to be, and they have to pay our fees. And that is a disruption that is very powerful, and most of the dentists who are more advanced and they care about the quality of their care, they just cut the ties, get the autonomy and control in their own hands, and they will use that to get a better, usually diagnostic technology in their offices, because when they're not accepting the insurance fees, they can actually have proper fees that they can properly compensate their staffs and have the resources to invest in better technology for their offices and higher quality of service. And they use that technology to catch things much earlier. Now, insurances fight back in this. They want the money from the patients and they want to pay the doctors less. So when a dentist cuts the tie with these insurances, they will start sending mass mailers and communications to the patients telling them like, hey, this guy is not taking your insurance. If you want to save money, you should go to this other guy. So now the insurance companies come and take control of patients' health by alluding that the level of the care that they're getting from this other dentist is equal to the network. And I'm not saying that the in-network doctors have a lower standard or vice versa, but the system is working like that, punishes the doctors who don't want to play this game and actively forcing the patients into playing this game. Because what happens is that if all of these doctors get out of the network with the insurances, then the insurances need to self-adjust. There's an insurance called Delta Dental in dental industry. They have not increased their annual maximum since the 70s. In the 70s, they used to pay $2,000 a year as a maximum amount of allowed treatment for the patients. They still pay the same amount. And in the 70s, a crown was $200 and people were completely fine. And they function as these non-profit organizations with their executive having over $5 million a year salaries and having massive amount of profit, and they're keeping all of it for themselves because they don't even pay taxes. So there are all these full profit companies basically masquerading as non-profits, punishing the doctors who want to elevate the standard of care and actively forcing them to stay in the network with the insurances by monopolizing. Because if there are 10 doctors who are in network, the moment one of them doesn't want to play the game, they will punish that person by going after the patients and distributing those patients to other people. So all those other ones, even though they want to get out, they're so terrified of losing the patients because they're functioning as this small business that they cannot even do that. So they have to stay in network just for their patients not to leave. Because at the end of the day, the patients have this mentality that I want to go find the doctor who takes my insurance. But all of that underlying battle that those people are fighting never gets to the patient to know why does a doctor choose not to play with that insurance anymore, and what is happening in the back end that the doctors have to stand up for the standard of care against the supervised neglect, for elevating the level of the care they want to give to their patients, and also the type of operation they want to run by being able to hire good staff, retain them, and also go to these advanced educational seminars, train their teams, bring the highest technology. And one of the main things that are experienced as this widespread burnout situation that is happening in the medical field is directly tied to this. Doctors exiting the industry, doctors selling their practices, see less amount of patients, is because of this direct tension that they're feeling, that they want to elevate the standard of care, but the system is designed to punish who wants to do that. Now, what will happen is that each of those patients, without knowing, is contributing to this faulty system. system by this concept of, I'm gonna go to someone who takes my insurance, because in their mind, they're gonna save $100 on a cleaning or $300 on a crown. But collectively, when patients start doing that, now they are basically rewarding mediocrity and rewarding people who don't want to invest in any of those things, what I called relationship-based doctors. What they do when you go to them, they make you feel as if everything is great and you're in great hands, and you build this really nice personal relationship with them. They know your kids, they coach at your kids' baseball game, they really are tied in the community, they're these great personalities, and you go with them and you get this great patient experience, which is wonderful. But they use that to signal that they're a better healthcare provider, and it masks the underlying position that they might not go to the same level of education that they have to go. They might not update their technology to the level that can catch things so early on, and they might not want to elevate that standard of care for the patients, because doing that requires some level of friction, because patients hate hearing every time that they go to a doctor that there's something going on. They love to hear that everything is fine. And when you have enough patients, let's say 2,000-3,000 of these patients who are coming to you every 6 months, 1 year, and you keep telling them everything is fine because they're not sick enough to get the treatment, if you wait enough, you have 2,000 patients now that are all sick enough, and you built this incredible relationship with them, and they're desperate to come see you, and you're this hero that are now helping them become healthy. But then the question is, what happened in these 2 years that you were going to see them and they were telling you that everything was fine? What was the point of them knowing about your kids and about your vacations and about all those things while this underlying problem was developing into something that they were not catching it because they didn't want to get that CT scan or they didn't have it? Now, there's a lot of doctors that have both sides, which is incredible, and it's everyone's ideal to be that person. But what we see in the industry is that what is being rewarded is always the wrong thing. I know incredible doctors that lecture for other doctors that are the most advanced researchers in the area, and they have normal reviews when you go on their Yelp or Google. And then you have these other ones who basically haven't even been trained by this other doctor, and they're early on just understanding how to connect things on a deeper level, and they have these incredible 300 5-star reviews of all these raving patients just because they felt so much better in that experience. And that is what is being ranked on the social medias, on the Google ranking, and it's being translated as a better clinical expertise of a healthcare provider. That's another thing that is a built-in problem in our healthcare system, that we are not rewarding actual good work and results, and we're rewarding how the patients are feeling about it. We have patients that go in with 5 cavities. One doctor tells them you have 5 cavities. They get a 1-star review that this doctor dared to tell me I have 5 cavities in my first visit, and my previous doctor that I loved so much and I've been going to for 4 years never told me that I had a cavity. Therefore, this new doctor might be a horrible doctor, and that's across the board. So what the doctor does when a patient comes to them with 5 cavities, they're scared to tell them that they have that. So like, you know what? Things are looking good. I see some things, but let's watch them. Let's monitor them. When I see you next time next year, we're going to talk more about it. Just because they want to build that rapport first, because they're scared to tell them the truth. One of the issues that this model creates is that when patients come see us, they come with this pre-notion of distrust, coming feeling that you're going to tell them something they don't need. And by default, someone who's telling them that they need something, if it's not evident enough that the patient already is suffering from, then those are the people who are overselling them, or they're lying to them, or they're telling them some things that they don't need. And that is across the board right now, both in medicine and dentistry. Now, they come and you are seeing the problem. Now, the question is, you have to gauge their comfort level, and you have to gauge how open they are to knowing what's going on and how much you have to tell them what's going on without them getting offended by you. And this is something that if patients don't get educated on as a society, everyone is going to be worse off, because when enough people do this to the doctors, when doctors come out of medical school, they come with all this passion to help people. But when they get this feeling of patients feeling like they are their adversary or they're crooks or they're there for their money, little by little, it chips away from that original nobility that they were carrying the moment that they applied to go through all of that education in medical school or whatever, and they wanted to come and genuinely help them.